In Angola, key populations are no longer invisible. Civil society organizations that have been working in HIV for a long time are finally working for KP needs and with KP populations.
In Haiti, Linkages is one of the greatest investment, particularly the way it is tailored, the way it is implemented by local organizations.
In India, Linkages will pilot and scale up game-changing innovations to improve access and quality of HIV services across the continuum for key populations, which include female sex workers, men who have sex with men, and people who inject drugs.
In South Sudan, the Linkages project has trained the health workers, and the training has helped reduce the negative perception they had on key population health.
In Nepal, Linkages contributed to improve quality and access of HIV testing and treatment services through microplanning and innovation like self-testing and pre-exposure prophylaxis.
In Indonesia, Linkages is challenging the status quo. We're introducing new models of care, enhancing outreach approaches, and introducing new interventions like PrEP.
In Suriname, Barbados, Trinidad, and the Bahamas, the Linkages project has been critical to either creating or strengthening existing community systems and really created referral networks between and among key population organizations and governments. This has made a significant difference in the lives of key population individuals and their ability to access services.
In Burundi, Linkages project laid the foundation for the key population interventions. It was a very good opportunity for key population strengthening.
In Côte d'Ivoire, we are applying innovative strategies to reach, test, and link key population to treatment. Those that are on treatment, we ensure they are there to the treatment.
In Kenya, Linkages has built capacities of community-based organizations and are now taking leadership in ensuring that HIV programming in Kenya is sustainable.
In Mali, since Linkages started intervention by strengthening local NGOs, there was improvement in terms of quality of service provided, with a great intervention using Cascade for decision making.
In Haiti, Linkages has helped filling the gap between key population and healthcare services, and it has also helped decrease the stigma and discrimination among healthcare providers.
In Thailand and Laos, Linkages is bringing HIV self-testing to the supply of HIV services, thus allowing transgendered individuals and MSM to have a new method to find out their HIV status.
In Sri Lanka, Linkages is going to develop 3 learning sites engaging civil society organizations, and we are going to develop capacities and empower key population champions to strongly advocate for more key population inclusive policies and programming.
In DRC, in the past years, we have HIV prevention project targeting vulnerable people. However, now we have Linkages, which is taking into consideration specific needs for female sex workers. So they are really making a big difference in DRC when they are targeting specifically female sex workers.
In Swaziland, we've made sure to reach out and discuss options needed with the KPs themselves, and through the cascade from HIV prevention to care and treatment, we've made sure that the services that we provide address those needs that they've identified.
In Thailand, we introduced the enhanced peer mobilization model so we can link key populations from their social and sexual network to services. We also introduced same-day ART so that our key population has expanded options to HIV services.
In Botswana, we have increased access to care for key population by bringing services to the community and implementing differentiated models of care.
In Malawi, key population are now getting services through 4 service delivery models, and that's really a great achievement for both Linkages and key population.